A little bit late, so we're going to get the show rolling for this afternoon. Hope you had a great lunch. I am Joris, Silon. I'm heading up AstraZeneca here in the United States. It's a great privilege, a pleasure, but I'm also excited to be here today because I was just talking to the panel that is following how great it is to spend the day with a community of people that is excited about the climate and planet and health. And that's probably why I'm introducing this next session. I'm working for a company, AstraZeneca, who is passionate about climate and doing well for the planet, and is committed to do that going forward no matter what, because our mission is to improve outcomes of patients with chronic diseases like respiratory diseases, heart diseases, chronic kidney disease, etc. And we understand that if we want to truly improve the outcomes of these patients, they need to live on a healthy planet and they need a healthy society to become a healthy patient. As an organization, we've been working hard to reduce our own emissions. As you know, healthcare is a polluter as well. Proud to say that by 2026, we will have reduced our Scope 1 and Scope 2 by almost 100%, so we'll be carbon neutral by 2026. We just opened a new building in Cambridge, which is our UK, which is our headquarters, the Discovery Centre. And it's a bit of a fun fact. There's 2,200 scientists working there, and labs need a lot of energy. And the whole building is using the equivalent of 2 UK households a year to produce that whole plant. So just an example of how we're doing as much as we can to reduce our own scopes. Now we're working on Scope 3, a little bit more difficult, and that leads me to introduce the panel. They're going to talk about journey maps and tools and cookbooks, and I'm really eager to learn from them as well how we can work together to reduce not only our own emissions, but the emissions across the system to create a better environment for our patients. With that, I'll hand over to Jeff to take it away. Thanks, everybody, and enjoy the session. Thank you.
Just go on. You guys go on. All right, thanks. Thanks for coming back from lunch. I know taking a nice walk on the mall would be more exciting than chatting with us. There's actually 5 of us. Kathy Gerwig will be on the remote here in a minute. I'm Jeff Thompson. I'm a retired pediatrician and former CEO of the Gundersen Health System. The bios for myself and everyone else is in the electronic booklet that we received, the briefing book. And so we're not going to spend time doing that so we can possibly actually be done on time. We have lots of great information to have there. I want to start out by thanking NAM for continuing to pull on these oars. This is important work. It is about the health and well-being of our communities, our patients, our families. I think it really is important. Thanks for all those tuning in online and your smaller carbon footprint than those of us that traveled here, except for those that you rode your bikes. Thanks for that. Notice that. And all the volunteers and staff that have helped put this on. It really is a great convening, and this will be recorded so that people can look at it on their own time. There's Kathy coming on. Hi, Kathy. Nice to have you, as always. So this session is about doing something. There's a pathway that all of us know of having a vision, building a strategy, doing something, and then actually accomplishing something. What we're doing in this session is to try and talk about a couple tools that can help you move into the doing and the accomplishing. This isn't about saying the battle's lost. It isn't about saying the world's changing, we don't know what to do, wring our hands. I'm an old ICU doc. You don't wring hands, you do something. Right or wrong, you do something. You don't just sit. This is going to be an opportunity to distill the minds of many very smart people, and the tools that Robert and Kathy are going to help you understand are well thought out, well referenced, and can be used by a variety of people at a variety of stages in organizations. These, of course, are not normal times. Times are never normal. They always keep changing. Our approach needs to take on our responsibility locally, to our patients and families, regionally, to a state, to our nation, to the rest of the world. We're pretty connected. So I want you to think about that, how these tools can be used to actually take action regardless of the stage that your organization is in. We're going to start with Robert. Robert's from McKesson, and like Joris from AZ, it is critical that the provider network understands what a huge advantage it is to have our suppliers, our pharma partners engaged with us and boldly standing up and saying, no, we're in. We're in. I know there's headwinds. It's always headwinds. We are really in. So I want to thank you for that, Robert. And
we ready?
Cheers.
We ready to jump in? And I'm going to beat Colin to the first joke. As Jeff said, it's a panel of smart people and me. So the only doctor not up here, actually. So you figure that out on your own. All right, so here we are, the session just after lunch and right before the next break. I don't know, y'all figure that out, but I think there's a reason for it. But we're going to talk about our sustainability journey maps. I'm going to talk about the supplier one first and then hand it off, and we'll jump into the provider or the clinician one, depending on how you want to call it. And the reason I'm using those words is because as we go through this, you're going to see words on here, some fillers, words that don't make sense. It's because this is meant to be a demo. We're still working through the details of it. We're still sorting out some of the connections. And so you'll see some of that filler. But without that filler and without the work of Justin and Jessica, we wouldn't be here and the entire NAM team. So I just want to give them a big round of applause, please. What you're about to see is because of their awesome work, and we're just presenting it. All right, so the sustainability journey map, y'all have all seen this. It has been refreshed, and we have new graphics. We have new ways to navigate it, and we've made it a whole lot easier. This presentation is going to be a whole lot like the book, If You Give a Mouse a Cookie. Has anybody read that? If you give a mouse a cookie, he's want a glass of milk. If you give him a glass of milk, then he's going to want to, right? It just keeps building. Okay, so we're going to go through that. You'll put the analogy together here shortly. So this is the landing page. Of course, when you get to the landing page, what's the first thing that you want to do? You want to scroll down, and you want to see, well, what is actually on the landing page? What is this sustainability journey map about? You have the opportunity to scroll down and see that. If you want to then jump to the provider or the clinician map, you can easily make that step as well. I don't know why you'd want to scroll down that far because the supplier map's ahead of it. And of course, if you want to take a survey or just easily scroll back up to the top, we've made that navigation simple for everybody. But once you get there, of course, you just want to launch the map. So that's why you're there, right? Is to take a look at the sustainability journey map. And once you click on that easy to access button, it takes you directly to the first stage. Then as you scroll through, you can see all of the various different resources that are available to you. They have been consolidated and grouped for ease of find and ease of navigation. And of course, we still have the button at the bottom that takes you back up to the top. Because why? Because once you're in it, now you're going to want to, of course, explore the first stage. And understanding what the stages look like, being able to go through what challenges or the stage resources are available to you, being able to jump between stages if you want to skip a stage, because the journey map, remember, isn't just a linear thing. If you want to jump in at stage 2 or stage 5, you can. Or if you need to backtrack and go back to stage 1, it's easy to do. Once you're in the stages now, you're going to want to look at the various different resources, understand where those resources take you, maybe click on a few of them and go see, oh, look, these are external resources. Isn't this fantastic? I wish I could have done this earlier. Well, now you can. because we've set it up that way. Make it easy for you. If you want to scroll down and go look at the various different stage resources, they're direct links. It's easy for you to get to and very accessible. You can also go and look at all the various different stage resources, and we've made that easy for everyone to get into. So let's go explore what some of the stage resources look like. So you go in and you say, all right, I want to just look at the different stage resources. I want to just go look at the resources. We got a button for that. You saw the button. And you just want to filter by stage or by keyword. Well, now you can do that. Previously, you couldn't. You had to go and look through all the various different resources. We also have an easy button on there where if you type in the wrong word and you pull up the wrong resources, you can just go and clear the filters. Because sometimes, if you're an old guy like me, you just want to scroll through all the list to make sure you didn't miss anything. That's available to you at the bottom as well. So this resource library and refreshing this also gives us an opportunity to introduce new tools. And this is one of the new things I wanted to talk with you about, is our new tool that we will soon be adding into the sustainability journey map, and that is this leadership on climate transition for suppliers. And it's a new training that we're creating that is to enable the healthcare supply chain to come on this journey with us. We've partnered with Guidehouse and National Academies of Medicine to create this training. It'll be free for anybody within the supply chain of the healthcare sector that wants to use it. It is tailored specifically for the healthcare sector, and it's meant to enable suppliers to be able to come along with us. It is meant to also be easy to do for those of us like McKesson that have science-based targets, where we have set targets around having 70% of all of our suppliers have their own science-based targets by 2027. This training is structured so that they can actually help us meet that goal. This training, created by Guidehouse for the CPG industry, used to take 2 years. And we partnered with them to shorten it to 4 months. So it's very easy to take. It's much more practical. And I don't know if I mentioned it, but it's specific to healthcare. So that makes it much more attractive to them. As you go through it as a supplier, it's also something that you have your own benefits from. It's not just for the company that invites you to do it, or for the company that, like McKesson, has their own science-based targets. Now you have a skill set that you can market, that you can utilize on a much broader scale. So it's meant to remove barriers and to enable all of our suppliers to come along on this journey with us. So that is the Supplier Sustainability Journey Map and our new forthcoming training. And I'll pass it back to you, Jeff.
Well, that's terrific. If we start looking at it, what do we have? We have the will and the interest. I already mentioned the will of the supply side to just pull on these oars and help us a lot. They dedicate senior members, maybe not as seniors, Colin and I, but senior members of their teams to work on this effort. And now we have a pathway. So we have a pathway. We're training people to navigate the pathway. There's other training available. There's other individual training that Cecilia Sorensen and Columbia and a group has put together to work on individual leadership connected with sustainability training. And there's a link that will be available online for that. The National Academy of Medicine has an education and communication working group that put together a climate collaborative, and it's hosting a series on climate and health regional learning collaboratives. And Columbia is also working on that, but it will uplift and showcase regional and local activities. So this is community building education. So we have supply side, we have individual leaders from the provider side, we have community building. So we have a pathway. Now we're training folks for that. And the pathway that we talked about was the supply side pathway. And now Kathy will talk to us about the provider side pathway. Very similar. You'll notice a lot of similarities, but a few important differences. And Kathy will go over that. And here
Great.
she is.
Well, thank you so much. I'm really delighted to be here with you all and appreciate being able to do this online. And if you can go to the next slide for the journey map, I'll talk you through that. So really, this is the care delivery journey map is how I'm going to refer to it. It builds on the really great work of the supply chain working group. In fact, when I first saw the initial version of their map, I had a little bit of that journey map envy and thought, we have to do this for care delivery. And so a fantastic group of people that are within the care delivery working group took on that task and developed the materials that you're going to see. This is a sneak peek. As Robert described, the integration of these two maps is what's happening right now. And so I'll walk you through the content of what the care delivery piece will look like. It will have all the same bells and whistles that he mentioned around keyword searches and the other features. So it will be a fantastic interactive tool. This part of it is designed for use by C-suite executives and healthcare workers in any type of healthcare setting, large systems, rural facilities, outpatient clinics. And like the other one, we intend the tool to meet people where they are. So someone's new to this work, they'll find a place for them. Somebody who's well on their way to this work, they will find tools to enhance their program within this map. The aim is to provide an easy-to-use source of key actions and resources. I'm going to repeat that. It's key actions and resources. This will help users advance sustainability in clinical care delivery. The tool is not an encyclopedia. It is a curated resource. It's pretty easy to get overwhelmed when you start looking for resources that are out there. And we've tried to take some of that guesswork out of it, get you started, and open the door to those other resources when you have a need for them. So keep in mind it's curated. And for each stage, our map, the care delivery map, has 6 stages. And for each one of them, there is an overview of the stage, some specific actions we're recommending, and then the list of curated resources that go with that stage. So if you can move to the next slide, which is stage 1. We started where many people find themselves when embarking on sustainability, and that is, how do you articulate the benefits? Some need to present a case to senior leadership, some need to engage clinicians and others within their units. Others are meeting with community members to represent care delivery in this space. And so we've called out 8 actions that are helpful in defining what the benefits are to having a sustainability program. So alignment with mission is an easy one. We also talk about how sustainability efforts can improve quality of care. We have a section on how this work benefits staff well-being and recruitment and retention. This morning, there was a lot of talk about staff well-being, especially in climate crises, and you'll find information about helping to address that in this section. Lowering costs, and also, importantly, avoiding costs of inaction in this area. Certainly a benefit around supporting emergency response and resilience. We have a section called Health for Everyone Everywhere, and it's our language for how sustainability supports health equity. So how do we make sure health is delivered to everyone everywhere, especially those populations who are disproportionately impacted by climate change? We have a section on reputational benefits, and then we close it out with how this work helps meet regulatory compliance and accreditation needs. So moving to stage 2, this is how to integrate sustainability into core business practices and organizational protocols of care delivery organizations. So we start out by talking about what are the actions needed to gain leadership, engagement, and commitment, and what are the resources to do that. we outline the need to have a sustainability lead who has the authority to actually create and execute plans. And we give a gold star to organizations that can have a medical director for sustainability, especially large systems. That's an essential role. Next, we talk about operating protocols. So this is how do you embed this work into strategic and operating plans, into budgets, those sorts of things. We have a section on how to set targets and measure progress. And we also have a section on internal accountability measures. So it's one thing to have people who are passionate about this work. It's another to say these individuals are accountable to the organization for the success of the plans that we adopt. We talk about how to educate staff on the health risks of climate change. And then working collaboratively with others is an essential step, and things like joining this collaborative network is one of the ways that we recommend people do that. So moving to stage 3 of our 6 stages, this one focuses on reducing emissions that come directly from powering facilities, using anesthetic gases, having fleets. These are the scope 1 and 2 emissions, if you will. And we focus really on first quantifying those direct emissions, because if you don't know what you're working with, then you can't reduce them. And then setting realistic goals for that reduction. So that includes things like understanding current reduction strategies that are perhaps already in place in your organization or in neighboring organizations that you can learn from. Next is from that determining what's most suitable for your organization. For some folks, it may be a big attention to water conservation, and others it will be something else entirely. And then actions and resources outlining how you make adjustments along the way. So moving to stage 4, this is where we get into supply chain, and there is, of course, a lovely crossover between this stage and the supplier journey map. But for a typical hospital, about half of all their greenhouse gas emissions come from the supply chain, about half. So that's our focus in stage 4. It's enormous. And so we start by measuring and reporting those emissions. It can be a little more challenging to do that than with scope 1 and 2, but we have resources to help people do that. Clinician leadership is really essential to reducing supply chain emissions, and we outline specific actions that we need clinicians and their leadership to take in this regard. How to set goals and have a plan that supports lower emissions while building a more resilient supply chain. We've heard a lot today about resilience and what happens when the supply chain is disrupted. And so we have tools for care delivery folks to engage in that work. We have actions around how to look at product selection protocols and how to include emissions reductions as a feature along with things like the quality of the product, the accessibility of the product, and et cetera, to build into those protocols emissions reduction attributes. And then finally, and perhaps most importantly, I'll say, is engaging with suppliers about the desire for more sustainable products and more resilient supply chains. Our supplier partners in this work always want to know, well, how are you making decisions about the products you buy by incorporating sustainability? Show us how that's happening, and that allows us to be better at delivering the products that you want. So stage 5 of 6, as we roll right along here, stage 5 is a bit of a catch-all for all the other emissions that are important and not detailed elsewhere. So these include actions around reducing waste. This is physical waste. Transportation, which includes business travel, supply deliveries. We have a section on staff commuting. We have a section on food services that includes food packaging and looking at serviceware, especially disposable serviceware. This is where we have information on maximizing telehealth. And then a section on looking at investments. Investments are a major source of greenhouse gas emissions for care delivery organizations that have pension funds or other investment portfolios. And we have some suggestions in our map for how to address those emissions. And then closing out here, our last item is stage 6, and this is where we keep the improvements going. So the fact is that reducing emissions is similar to any improvement program undertaken by care delivery organizations. We need to treat emissions reductions in the same way that we address other improvements. So we talk here about how you integrate this work into business protocols like internal audits and risk management, financial planning, talent management, bake it in there. We heard earlier today, this needs to be baked into the work of the organization if it is to survive, especially, some of the current pressures that we see today. So this is one way to bake it in. We also want to leverage existing programs that care delivery organizations all know about: Six Sigma, Lean, high reliability organizations, other quality and safety programs. We recommend ways to keep scanning for new opportunities and new obligations. This is an extremely dynamic field. And then finally, focusing on using risk assessments to build resilience. So, that was a lot, I know, and now you know why we're enamored of the Journey Map user interface that Robert introduced and that is almost finalized now. It will allow people to drop into the areas of interest, look around, move as their opportunities and risks emerge and change. And so that's what's happening next. The next steps are to finalize the visuals and the user interface. We are still finalizing the resources. Again, this is not an encyclopedia. It's a curated list, and that will be finalized. And the plan is to go live in early May. And one thing, others can comment on this too, but we do want to be able to periodically update this work as new knowledge comes to bear, advancements, experiences that we want to highlight. We want to be able to keep this up to date. And so this will be ongoing work in the care delivery working group, and I'm sure also in the supply chain working group. So thanks so much for letting me run through that with you, and I'll turn it back over to Jeff.
Thanks, Kathy. That's terrific. And as you can see, tremendous amount of thought and information, not just randomly put out there, but curated, as Kathy said. This is knowledge from decades of healthcare without harm and engineers and people in the government and many people that have worked together to say how do we do this best. And so when we have these terrific tools presented to us, now we have to implement them. So I'm gonna go to Hardeep first because Kathy just got done. Hardeep, on the clinical journey map, think about how we're going to adopt this. How can people use this as a tool to help them accelerate their uptake in their organizations?
Well, Jeff, thanks. And thanks, Kathy, for the presentation to lay the groundwork. In healthcare, we have a lot of competing priorities. We're always sort of putting out fires, if you will. And so in order to adopt this, Kathy gave us a lot of nice information about, reputation, regulation, risk, resilience, all those things, why healthcare organizations should care. But I think we're going to need to sort of think about the current environment. I don't think there's C-suite folks and healthcare leaders jumping on to sort of like adopt this right away in their organizations, at least as a whole. The way I think of this is, I think we need certain principles for accelerating implementation. The first one would be, this is like an implementation blueprint. It has a menu of interventions or a checklist of interventions. And, we may have to start small. You just got to start somewhere and do a few things, action, if you will. The second is we're going to have to figure out how to integrate this into the quality and safety conversation. Kathy mentioned that, and I cannot emphasize that we need to normalize this sustainability journey map with quality. And sort of the third principle I was sort of been thinking about is, especially with the current environment, there are certain terms that are going to do better than the others in the organization. Cost, resilience, efficiency, and waste, I think, would be ones that would resonate. And then we're going to need some people specifically who can help us accelerate this change. And I'm thinking there's a lot of healthcare providers, professionals that I talk to. Almost invariably, they are centered on things that they can take action on. One thing that I can see unanimous agreement is waste, single-use plastics, pharmaceutical waste. They can all associate with that, and there's elements of that in the journey map that they can help us sort of accelerate uptake. I'm also thinking board members. Boards have a lot of accountability. They can build accountability for healthcare organizations. I think we could use the board members to try to ask their healthcare organization leaders, what are you doing with this journey map? Another one that I'm thinking is payers. I've been really excited about getting a lot of the payers into this conversation. They are wanting to do more things. And this could almost be some type of an accountability framework or a structural measure, if you will. Is your organization or your practice or your clinic using this journey map to advance the conversation? And then lastly, a very important player in this game of acceleration are the patients and the patient advocates, because once patients find out that healthcare organizations and clinicians have access to this type of a journey map to help implement good clinical practices and close the implementation gap, they should be asking questions. Is my organization implementing this tool in order to sort of improve care, improve quality, reduce low-value care, all the things that we need to do?
Oh, that's so lots of opportunities. I really like it that you've framed it in multiple ways, because I think each organization, each individual, they might have a different audience that they can do, but when you start thinking about it, it can be used as a guide for the sustainability coordinator. It can be a inciting act for a clinical group. It can be a coordinating activity with community members saying, what about this? Here's how this fits in. Tell me, Hardeep, one of the groups that it seems odd to me. We've had big conversation all day and many side conversations over the weeks. We're talking about asthma and we're talking about health across populations, and yet almost never, and we're talking about the sustainability, we're talking about individual docs, but almost every organization has population health departments. Wouldn't you think if you were in charge of population health that this would be kind of high on your list?
I would say so.
Why isn't that not in the conversation more often, do you think?
Absolutely, because I think one of the things is in healthcare, we often love to live in our own silos. I often talk to sort of people in different departments that are not sustainability or environmental engineering, and they're like, well, we just have never had a conversation. And the clinicians would be like, well, did we even have a sustainability officer? And the sustainability people are like, oh, we don't want to really talk to those clinicians because they don't want to hear from us. They always give us pushback. So I think we really need to break those silos between, population health, quality and safety, environmental engineering, sustainability, and, the administrative leadership in order to get to what you're trying to get us to do.
Yeah. Now, just one thing popped into my head. As Kathy pointed out, the clinical journey map is not active just yet. It will be soon. Keep looking for it, but don't set up a meeting with the board next week and try and show them all the cool things that Robert showed on the other one. It's not going to happen. So try it out. But I think the breadth is pretty good. But back to Robert's work in the supply chain, which is of course very important. We all know it's a huge part of our carbon footprint. Colin, I want you to give us a perspective on, this is all, again, a nice chat that I'm making fun of, but people have actually taken this kind of work, not exactly this work, and done it on their own and made a difference. And you're coming out of Kaiser, who's done great work for a long time. Kathy was a part of that. Many folks from Kaiser are here and very supportive I want you to tell me how it looks like to address supply chain issues, and what evidence do you have that it actually worked? I mean, the difference between doing something is good, but accomplishing something, I want to make sure you get to the accomplishing something part.
Absolutely. Thanks, Jeff.
Before we turn your mic off.
I'm going to know if you turn it off. Thank you. And at Kaiser Permanente, when we talk about purchasing, I mean, we take care of 12.5 million patients. So there's a lot of buying that goes on. A lot of that is impact spend. There is, with our sourcing, there's indirect sourcing, which is all of those things that don't take care of patients, and then direct sourcing. Because we could talk about everything, I'm just going to focus on direct sourcing today. That's direct patient
What's
care.
an impact spend?
Impact spend would be putting money in the communities to allow those communities to be healthy. Money in communities equals health. And so being careful of how we phrase these things these days, we want to support businesses in the communities in which we exist so that they can increase their health and pay living wages to the people that work for them. So for the direct spend, the money that we spend on patient care, we're going to do three things. We'll talk about a little high level, then we'll talk about contracting influence, and then we're going to get to what Jeff wants is some examples of success. So at Kaiser Permanente, we have a $3.5 billion annual direct spend on patient and care-focused equipment. It is headed by the National Product Council. The chair is a head and neck surgeon, a colleague of mine, and they oversee 80 specialty groups. In each of these specialty groups, there is a Permanente physician, there is a Kaiser Foundation health plan individual, and there is also our group purchasing organization, who happens to be Vizient, embedded in each of these 80 specialty groups. These groups then are responsible for figuring out what we're going to buy. And we want good prices, we want high quality, we want the physicians and clinicians to have input. And so overall, we have 500 physicians, nurses, and allied healthcare people on these groups, supported by 300 operations and supply chain and technical experts. So it's a really pretty impressive group of people. Now, how does that work with regards to contracting? So our contracts, yeah, we have 12.5 million patients. We have a lot of money that we spend, but we're not the best at contracting on everything. That's where a group purchasing organization comes in. And this is an action step. We want everybody to belong. About 60% of our contracts are Kaiser Select. We don't do the contracting. We have our group purchasing organization do the contracting. But 40%, we just use the contracts that our GPO provide because they can still do things better. Where this conversation goes with that backdrop then is, how do we get environmental and sustainability involved? For our direct spend, we have 48% of our contracts this year that have an EPP, an environmentally preferred purchasing clause within it. We rely on our GPO to go to our suppliers and make sure that that is put into the contract. Our goal for the end of this year is 50%. We can come back to some of, there's not a direct relationship between having these clauses and then having your scope 3 go down, but that's another story. We want our GPO to socialize with our suppliers that we care and that we're going to be asking for these in our contracts, and it's going to continue to increase. So we rely heavily on our GPO. We have a great physician and health plan hospital interaction. We break down the silos, and we work to get these EPP clauses in our contracts. Success then looks like not just having a contract, but what does that mean? We're big enough that we can go to the suppliers and say, hey, look, our IV bags have DHEP in them, and it's bad, and it leaks, and it's going to hurt people. We want you to come up with a product that doesn't have these bad chemicals. And then they come back to us with a lot of innovation and research and development, and they supply that with us. In 2022, we were able to get rid of all of that from our IV bags and our IV tubing. So our products are safer. We want to remove, and we put a high priority on recyclable and biodegradable products, and so our ophthalmologists no longer have plastic bins in their packs. We've worked with a company to create a soy-based bin that is completely biodegradable. Now, there's an entry-level speed bump, if you will, because of the R&D and the cost. So as a purchaser, we have to make sure that we commit to purchasing, and we want a whole bunch of people to join the GPO so that they can buy those products as well. So that's our bring to the table. And there was another one which has eluded me, but I think if I think of it, I will let you know. But that's sort of how we have the overarching, how we embed our EPP, and then the success that we can see in getting our providers or our suppliers to do that.
Very good. I think that's really helpful to the group. Everyone doesn't have your purchasing power. And Robert, I'm going to ask you in just a minute how, if you're not the size of Kaiser, how other health provider organizations can connect with and talk with the supplier organizations. But first, we were talking about outcomes here, and Hardeep, one of the things that healthcare organizations complain about is measurement fatigue. But one of the things we all know is that measurement often is one of the key tools we have to see whether we're actually getting something done, what we're talking about here, and making progress. When you look through this journey map, which is seems a lot when you look at it broadly, but of course all the individual pieces can be pulled out. What are the key measures? If someone's saying, yes, we're heading down this way, this makes sense, we could measure 1,000 things. What are the key things should they be looking at? Or how should they approach that?
Sure. So, when I think about measurement, I always think of measurement as action. Like, that's the reason why you do measurements, right? And I think the journey map has several sort of constructs that could be useful for at least your internal sort of learning and improvement. I sort of try to distinguish measurement for learning and improvement versus measurement for accountability, which means somebody else is sort of coming up with measures that you're talking about, the ones that we complain about, such as quality measures, some of which don't make sense. And I think there's several constructs in there that would be useful for people to look at. There are obviously things that are to do with emissions, whether they are direct emissions or they're indirect emissions. But also there are what I would say called structural measures and process measures in there, where you can look and see, are we doing this? There are great clinical practices in there that you can say, are we doing this in an organization or not? I mean, even if you don't even have a sustainability officer or the governance structure to put into place some of these best practice interventions, that's a start. So that's your internal measure. You really need to sort of invest some resources. You got to do some waste audits. Whatever it is that interests you, you could literally convert that into a measure, which is also brings me to the point that, yes, right now we don't have a set of well-accepted, standardized, measures for all healthcare organizations or for all nations, for that matter. So the good news on that front is I'm working with Matt Eckelman, who's over there, and Jody Sherman and Andrea McNeil and many others on a Lancet Commission for Sustainable Healthcare, where we are trying to propose a measurement framework as well as a standard set of metrics and indicators that nations as well as healthcare organizations can use. So hopefully that should accelerate the standardized uptake while we use the current journey map for internal benchmarking, internal learning and improvement and action, which is sort of what needs to happen based on those measures.
Back to Kathy's comment about curated references. We needed curated measure guidelines for these standard measures so that we can measure the same things in the same way. We can talk to each other, but not measure everything in the world.
And also we need to make it automated. I didn't mention that.
Yes.
More and more automated, the better it is. And we don't want to go to those quality measures that are so manually extracted that we're spending millions per health system on just the manual reporting part.
So I'm into this warning. I'm warning we have 18 minutes left. In a couple minutes, we'll ask the audience if they have questions. So please prepare your questions. And anyone that stumps the experts here will get a big prize for you. Justin, you can work on that. And Kathy, I'm going to ask you about barriers, because if you're in charge of implementing this in 5,000 hospitals and 100,000 clinics in the country, what would be the most common barriers? So you get a minute to speak about that. While Robert goes to his question, which is, how can we work with suppliers? We've already seen
Sure.
McKesson, Astra. There's a bunch of suppliers that have stood up, J&J are here, and said, we are in, we will be your partners. How do we do that with these big, giant corporations?
Yeah, before I get into that, I want to just quickly address the measurement thing real quick. So just by a show of hands, and for those online, you can do this too. It'll be fun. You're by yourself. Raise your hand. So who thinks that you're measuring too much right now? Raise your hand. Anybody? Okay, great. So actually nobody raised their hand. If you raise your hand online, you're by yourself. All right, who thinks that you're measuring at least two core aspects that are very important to your organization? Okay, fantastic. So we've got some hands up. But see, this is why the partnership and working together is so critical, and doing the work that Hardeep was talking about and identifying what those key metrics are is because we don't all know what they are. And this is how we can come together. We can partner in common ways. And that's what a lot of these journey maps are about, is finding those common elements so that we have this collective work that can come together and partner on the things that matter the most. And it's great learning as well. And this is part of the reason of why we created this for the suppliers, is because you're absolutely right, Jeff. Not everybody has the access to suppliers. And part of that comes down to the suppliers themselves, right? And I'll use this term, we call it sustainability by stealth. I think a lot of companies already do this. You take out as much electricity, as much fuel, you reduce your packaging as much as possible. It's just a good way to do business, right? Because you're improving your bottom line, you're reducing your overall costs. And so in some ways, it's on the suppliers to communicate to everybody, hey, look at what we've done. We've already made your job easier, where if you come to us, if you partner with us, you're inherently going to find these tools, these reductions at your fingertips. So I think it's on suppliers in some ways. And then in other ways, it's to come join us in the journey. So it's a journey map so that everybody can jump on to the journey map. And we're creating this training so that if you don't have those tools, if you don't know what to be measuring, if you don't know how to do the measuring, there's an enabling function there. So it allows you to come along and to invite whoever you want to come along with you. So again, did I mention it's going to be free? There's nothing compelling about it. There'll be 4 different ways to do the training. You can do asynchronous, you can do live, you can have your own consultant take you through it. You can watch the live trainings from other people going through it, kind of watch people having fun. Not everybody likes to do that, so go through your own live training. So, but inviting others to join you, and then also utilizing those tools and recognizing the work that suppliers have already done, I think are 3 of the key aspects.
That's really quite good and quite useful. Kathy, let's talk about barriers. I mean, we started out talking about we want action out of this. We want things to happen and folks to accomplish things. If you were responsible to spread this across the country, what do you anticipate would be the most significant barriers that people would experience in trying to use this within their organizations? And what are we doing to help mitigate that?
Well, I think the barriers to using the information come from the barriers that exist right now with why we don't have sustainability more widespread throughout care delivery organizations. And I'd say number 1 on that list is there is just a lack of appreciation on how sustainability actually benefits their business. I know it can be unsavory to think about care delivery as a business, even for nonprofit care delivery organizations, but they operate as businesses and they don't typically appreciate how this fits into helping them save money and address employee well-being and staff retention. So core problems to their organizations can be assisted through sustainability, and that's not well known. So that is why stage one of our journey map goes through the list of, there are 8 ways in which this significantly can support the business of care delivery. And along with that kind of being the primary problem, I think there's a sense that one organization can't impact what is a global problem. And so it's not really my problem because it's everybody's problem. And we think in this tool, we offer proof points for why collaboration, just the conversation we've had here, collaboration between suppliers and purchasers of equipment and supplies, that collaboration is powerful. There's a ton of money behind it, as you heard Colin say. So changing that framework that this is a global problem that care delivery organizations can affect. And then I think the other barrier is it feels like it's something that's done off the side of your desk. There are probably a lot of people tuning into this program who are doing work in their jobs, and it's not their assigned duty, but they're doing the sustainability work anyway because they care about it. Moving it into the mainstream is one of the key reasons we prepared the journey map, was to say, here's where to start. Pick a few things. Hardeep mentioned focus on action and measure that. So pick a few things. And I think our journey map offers that curated list of actions and measures and resources that can help people overcome this barrier and make this appreciated by the leaders who need to sign off on this work and give it their full-throated support.
We're going to have questions from the audience, so if you'd come up, that would be great. Colin.
Yeah, thanks, Jeff. I was just going to piggyback on what Kathy said. When I first started this years ago, the big pushback from operations is, this is all great, but we have a business to run. And so we had to have some wins to show that doing the right thing actually saves money. Anesthetic gases, acute care, hospital at home, telehealth, all save money, all improve quality. And then people start understanding, oh, so sustainability is worth something. And the other thing that we've learned in our contracting is reprocessing. Reprocessing single-use plastics is a win-win for everyone. And even those companies that won't take their own instruments back to reprocess, we can contract with a different company to put it back into the same situation as it was and rebuy it. It adds to the complexity of contracting, but it is an operations money-saving endeavor to do sustainability right.
And if I can just, Jeff, Colin raises a fantastic point. Ensuring that you're linking your activities to business value is key, because doing good is good for business. I mean, it's the business case is out there in every single instance that you can identify. And I'm sure that you can find all kinds of partners that can help you, either with tools or with anecdotal evidence of how they have delivered the business value. So I really wanted to expand on that. Thanks, Colin, for bringing that up, because I think it is absolutely key about it drives business value.
I think the really shorthand version of what Kathy was teaching us is, if you're going to implement the map, regardless of whether it's a provider group, the C-suite, the nurses, the frontline environmental services area, you have to understand what matters to them. Not what's the matter with them. They're not smart enough. They don't understand. They're money grubbers. You can put a lot of things, but it's what matters to them. And that's that. And then you can build the case, because this can solve a lot of problems. We have some online questions, and then we have a question here. So we'll take the question in the audience first and then go to the online.
My name is David Schoen. I'm with the nonprofit Association of Medical Device Reprocessors, and thank you all for your work on the journey map. It's fantastic. My question is about life cycle assessments. Several of our members have produced peer-reviewed life cycle assessments. I think we have 8 so far. And I'm wondering, as you review the journey map and think through this, especially in scope 3, what your views are, if you've formed views on life cycle assessments as a tool, and if there should be a set standard within them or standards, or where your thinking is open to the whole panel.
So, David, thank you. It's a great question. We actually have 3 different working groups within the NAM's supply chain working group, 3 subgroups, I should say. One is on the journey map. Another is on a common questionnaire that is coming out here soon. And the third is tied directly to the work you're talking about on LCAs and a hotspot analysis. We would encourage you to please come join us in the discussion on the hotspot analysis. The expertise, the background, and the information you were just talking about would be extremely valuable. But we'll be having updates on that hotspot analysis. I think that ties in exactly and directly with what you're talking about here in the next couple of months.
As a former CEO, what I think of is it'd be great to do life cycle analysis on CEOs and see what their long-term impact is. That might be off topic here. Oh, on to Justin here and get us back online.
Yeah, thank you so much. A couple questions from our online participants. The first one is, it's great to see that GPOs are using their leverage to support environmentally preferable purchasing, but what standards are they using to define environmentally preferable, and how transparent is that process across the industry?
So I guess I will address that since I brought it up. I think, first of all, I would go to each GPO individually, and then I would go to the people that contract with them. EPP is a very broad spectrum. It's an environmentally preferred purchasing clause. Kathy can probably help me out on this one as well, but there's not a standard per se. We go to when we have a new supplier that we're trying to work with, we go in and try to help them understand their risk, to mitigate that risk. We have them look at their scope 1 and 2 so that they can get involved, and then they can change the light bulbs out and get cheaper energy, and all of a sudden realize we can save money and this is interesting. So we want to hook them. So not all of the contracts have the same clauses, and that's appropriate because not all of our suppliers are along their own same journey as some of our other suppliers. So great question. And I think that it has its own science. Kathy, would you add to that, or any thoughts on that?
I would just add that not all GPOs are created the same, and not all are invested in this work in the same way. So one easy action would be to, for folks in healthcare delivery, talk to your GPO and ask them what standards they are using. And some are very impressive, and others need your collaboration to help set standards and move in this direction.
Is this something that a convening body like NAM could take on, or who might develop a consistent standard with consistent definitions? Where could that come from?
Yes.
Oh, I guess I win the prize for stumping the crowd.
I got an answer out there. No
Okay.
prize for you.
Yes, right.
Absolutely, we could. I would just ask ourselves if that is answering one of the core needs that is out there. It might be, but one of the things I think as we kind of talk through with the measuring, you can get too far afield with certain aspects. I believe in many instances we have other low-hanging fruit that we could go and pick that would be more impactful.
I think that's a good point. I mean, on the one hand, greenwashing is a struggle because it dilutes other things. On the other hand, getting too overburdened on the other side may be problematic. Justin, an easier question, please.
Well, sticking on the same topic, we had another online participant ask, would you please expand on what is included in your EPP language in your contacts?
No.
Contract.
There are certain things that are that we can't share, but I would say that I will just leave it at that. I'm not a contractor. I'm not on any of the groups, so I can't specifically talk about what the EPP clauses are in each and every business. And if I did know, I probably wouldn't be allowed to talk about what each and every clause are within our contracts. But as Kathy said, there are some GPOs. I'll throw out Vizient. They're an incredible partner. And if you find a GPO that knows what they're doing, they will give you example EPPs to throw in. They will let you know what others are doing in that space. And they have their own percent goal by the end of the year to create so that a certain number of the contracts that they do have EPP clauses within them. And so you can just tack on to those. And I strongly encourage you to do so.
Can I just add real quickly, there are resources through Healthcare Without Harm and Practice Green Health on this topic. There are recommended standards for purchasing contracts, and those are all available. The key resources, the curated resources, are going to be in the journey map on the supply chain stage that I commented on earlier.
Great. Thanks. That is helpful, Kathy. I think it is a tough problem for an individual organization to say they're going to take on all suppliers with, I mean, this becomes a discussion beyond the capability and the energy level of most sustainability groups and purchasing groups inside organizations. John?
So this is a question very much along the same lines. And it's, Colin, if I heard you right, you said, that you felt like there was a need for providers who are doing the kind of work that you're doing to share that information with other providers to build out, to spread the word that you can do these EPPs, that you can talk to your GPOs, et cetera. And Robert, you had said that the burden of sharing information about the innovation and the products that are available is on the supplier side. So there's a supply side conversation to take place and a demand side. And Colin, you were talking about the demand side. My question is, do we have the right platforms for those conversations to take place? It seems like we talk a lot among ourselves. I mean, there's a Clean Med platform, there's a NAM, but that's already the kind of the in crowd. Is there a platform to try to make this case, and to, what we're talking about is really recruiting on the supply side to increase the demand for this? Do we have the right platforms for that?
Yes, and I'm going to rely on everybody else to speak too. I mean, CHARM is an initiative where it's bringing all people together to try to use a few specific ideas and figure out exactly what does the supplier need, what does the purchaser need, how do they do that, how do they get the mechanisms to measure. I think there's a lot of good in volume. So if you have more people purchasing together, they can go to the suppliers and say, we need you to do this, but the good news is we will buy more of it. So it's easier if both people win. I'm running out of time, so I'm going to cede.
Kathy probably has a comment about platforms.
Well, I agree with those that have already been mentioned, and I think I don't have a specific platform to recommend other than those that we highlight in the journey map. There are, I think you're absolutely right, John, around the need to increase demand, and part of that comes from having contracts that have EPP clauses in them and working with suppliers from the care delivery side, and also suppliers doing their own analysis and bringing lower emission products to the market that are cost effective. So I feel like it's kind of an ecosystem more than a platform question.
So I think that's a great final point, John, and I think it shows that none of these problems, none of these issues that we're trying to take on are going to be solved by the providers or by the suppliers or by the government or by anyone. If we ever thought that the government was going to solve all these problems, we were mistaken in the first place. Of course, there's going to be headwinds. But I think what I want you to leave with is that we have assets. We have great assets. You have, look around the room, the partners from so many different parts of our health system. We have courage. We have an amazing set of values that regardless of what's going on out there, we have people standing up and saying, we have big organizations, little organizations saying, this is the work we need to do, headwinds or no headwinds. This is where we're going to go. This is too important. And so our summary is we have these tools, we have to use them, we have to combine our strengths and combine our courage in times when the headwinds are more, not to just prepare for a rebuild, but to build forward during this time. We cannot sit still. The health of our communities are too important. Here's a pathway. We've got lots of partners. Our job is to get at it. Good luck. Thank you for your time.
Thank you to our speakers for those important remarks. But next, we'll be moving into a brief break to transition into concurrent sessions 5 and 6. Concurrent session 5, which is on protecting workers amid climate and health crises, will be held here in the auditorium for those in person and on the main event page webcast for those who are virtual. Concurrent session 6, Climate and Health Research Agenda, A Shared Path Forward, will be held in the lecture room for those in person and broadcast via the Zoom link on the NAM event page for those who are virtual. But we'll see you all here in 10 minutes, and I hope you all have a great day.